A community analysis of the City of Pinellas Park by John S. Murray, in accordance with the requirements of the Community Analysis Presentation for NUR 4636. Pinellas Park started as a community of farmland in the center of Pinellas County. Established on October 15, 1914, the city has grown to an estimated population of 52,137 residents. Today, the city is mostly urban sprawl with a mix of residential and industrial areas like most of Pinellas County. The city also has a small equine community with resources to support equine activities. Here we see the city limits of Pinellas Park within Pinellas County. Generally, the structure of the community is adequate to meet the needs of the residents of the city, with plenty of resources available to acquire basic needs for living. Additionally, numerous opportunities and facilities for healthy recreational activity are available, including a seasonally operated pool. Acute care opportunities within the city limits are lacking, but there are several facilities available nearby and accessible with several transportation options, including EMS services available. Private and public learning institutions provide education opportunities to earn up to a bachelor's degree with options for higher education, available online or through one of the campuses of the University of South Florida in Tampa or St. Petersburg. Transportation via car, bus, bicycle, cab, and walking is generally available throughout the city, with some redundancy provided by 2 main north-south roads and 2 main east-west roads. The city is home to a variety of businesses and a variety of industries that provide some employment opportunities. Additional businesses and employment opportunities are available outside the city limits. Primary structural issues of the community are related to scarcity of available land for future expansion should the need arise. The population of the city can be considered above average in some regards and below average in other aspects, depending on the particular detail being examined. The percentage of citizens without a college degree is much lower than both the county and state percentages, but the percentage of persons living in poverty is higher than the county, but lower than the state. So clearly, for some portions of the population, a college degree is not necessary to live above the poverty level. While this is not exactly a high level of achievement, it may be demonstrative that there are other pathways to prosperity besides obtaining a college degree, though that philosophical discussion is beyond the scope of this presentation. From a diversity perspective, Pinellas Park has an above-average percentage of Asian and Hispanic Latino residents and below-average percentage of Black African Americans when compared to the rest of the county. Compared to the state, the percentages of Hispanic, Latino, and Black African Americans in Pinellas Park is lower. The percentage of white citizens in the city is lower than the rest of the county, but higher than the state percentage. As for health-related resources, although there are no hospitals within the city limits, there are several close by, including Bayfront Medical Center, which is a Level 2 trauma center. Other health-related resources include numerous long-term care facilities, 2 primary mental health facilities, several urgent care facilities, and several primary care facilities. The City of Pinellas Park also has a Florida Department of Health facility within the city limits, offering a number of health services at a reduced cost. The environmental analysis of the City of Pinellas Park indicates that things are generally adequate for the residents of the city. Potable water is provided through 3 different access points from the county water supply. Sewage removal and treatment is facilitated through an extensive network of piping and lift stations that transport sewage to regional treatment facilities. Solid waste disposal is conducted through curbside pickup and includes recycling services that do not require sorting. Although air pollution could be a potential problem due to the high volume of vehicle traffic and close proximity of Pinellas County Solid Waste Treatment and Energy Reclamation Facility, no recent evidence of air quality issues within the city exists. Pinellas County Animal Services handles any wild animal issues, and Pinellas County Mosquito Control handles the primary threat for vector-contracted illnesses. There are ample sidewalks, parks, and recreation facilities for health promotion. Generally, the funding for the City of Pinellas Park's budget was well directed at resources that directly benefit the city, with 88% of funds being directed at resources for the city citizens, with the most significant expenditure allocated to the police department. Based on the observations of the citizenship, the number of individuals observed out and about at restaurants with apparent obesity problems and related circulatory problems, the highest priority this author chose for the community needs would be nutrition education and information. The second most important community need appears to be smoking cessation, as many people were observed to be smoking outside numerous establishments, particularly several establishments that offer outdoor seating for smokers. Exercise promotion would be a third in terms of importance. There are people observed to be participating in exercise, but many are not, as evidenced by the number of apparently obese and morbidly obese people observed at restaurants, grocery stores, movie theaters, etc. Expanded transportation opportunities for persons with disabilities would be the next item on a community needs list, due to the number of persons observed using electronic wheelchairs on sidewalks and in bicycle lanes when out and about within the community. Based on the assessment, additional crime reduction resources may be necessary, as 70% of criminal reports within the last 6 months were classified as quality of life incidents.